Bom dia to all at the National Primary Care Forum in Brasilia. This is Amanda Howe. I'm the president of the World Organization of Family Doctors, and I'm bringing you my greetings on behalf of myself and all the members of WONCA around the world. More than 150 countries now have contacts in our organization for family medicine, and many of them, like Brazil, have tried to make that a really core part of their system in healthcare, especially now because we are reliving again the Alma Ata Declaration. It's the 40th anniversary, and the World Health Organization is calling for all countries to really make universal health coverage a reality and to strengthen primary health care accordingly. So the work that you're doing is really very important. I saw this when I came to Brazil in 2016, and before that in 2014. I saw the health reforms in the favelas, in the countryside, and I saw the efforts that the people were making to get a better model of healthcare. Now, I know often we are defeated by politics, by the lack of resources, by many issues that make life hard for the people and can make it hard for the doctors and the nurses and the community health workers as well. But still, I am sure that what we do in family medicine and primary healthcare matters to the people. We know from the evidence that if you have a strong primary healthcare team, you will make care more accessible. If people don't have to pay, then it can be better affordable because it's close to home. The resources are not wasted by people trying to decide, do I go to this specialist, do I go to that specialist? They can get an initial assessment and diagnosis from their family doctor. And so that makes the hospital's work more effective and cost effective. And people like the fact that if they have a strong primary healthcare team in their community, they can actually have a dialogue. What are our needs? What are our problems? How can you better help us with this? And the clinics become their voice. They become the advocate. So if you have a bad accident rate or bad air or some contaminated water, the clinic will see that. They will see people getting sick unnecessarily, and we can advocate for them as well. So I think if we are going to get accessible, affordable care to everybody in a way that actually empowers them, that really prevents things, that allows people to get better education so they know better how to look after themselves, we've got to have strong primary healthcare teams, and we've got to have family doctors at that level. I'd like to remind your forum of the Rio statement. We made this statement together when we had the Global World Organization of Family Doctors Conference in Rio in 2016. And we said, WONCA calls for all countries to increase the number of family doctors in order to achieve high quality, comprehensive primary health care and universal health coverage to benefit the people, right? And effective strategies include improving the skills of doctors already working in the community, recognising family medicine as a specialty, enhancing the academic basis of the discipline like other specialties with good evidence and good training, strengthening the family medicine experience of all medical students, and then recruiting more students into postgraduate family medicine programmes and giving family doctors and their teams the recognition and the resources that they need to carry out their work. And so also making sure that the workforce is where everybody needs it, the rural areas, the inner city areas, the poorest areas, and giving the staff enough help to help them to stay and work in those areas, because it's tough, but it is really, really worthwhile. And the point of this is to deliver excellent healthcare for the people. It's not to benefit me or even you as my colleagues. It's to do good for the people. So thanks for that. I've got to go answer a patient call. Thank you and take care. Bye.